92.1 Wirral Radio. We're on DAB and online, and of course your free mobile apps as well. Right, I'm joined now by David Welsh from the Dry Eye Clinic, and he's going to tell us a little bit more about dry eyes. Well, David, what does dry eyes actually feel like?
It's a debilitating condition. It feels like having sand in your eyes. Maybe also a little bit of spraying a bit of perfume accidentally in your eye. It burns, stings, is really uncomfortable, and you're really struggling to blink, and it feels just like sandpaper, and it's a constant thing. It's not the sort of thing that just goes away. A lot of people have some dry eye issues, and what actually happens is they take some drops and it goes away, and then the body recovers and you're fine. But there's a group of people where that's not the case, and they just have sore eyes all the time.
So, David, what actually causes the problem of dry eyes?
There's several causes. Obviously, there can be environmental causes. If you're by the seaside and it's sandy and windy and hot, then you're more likely to get these issues. But there's a series of underlying issues that can be causes. A lot of people have reasons that their eyes get sore, which are to do with blockages in the glands within the eyes. It really is a clogging of a little gland that stops oil being produced. Now, very simply, oil lies on water, and as a consequence, if you lie oil on water, then it doesn't evaporate. Now, if it hasn't got the oil, then you can be producing tears, and they're just evaporating. And in the modern environment, we all sit with laptops, smartphones, maybe computers, driving, all these things, central heating in houses. And we've got a constant flow of warm air. But if we're concentrating, for example, looking at a tablet, you don't blink as often. So you're getting a lot more evaporation happening and a lot less secretion of the oils to prevent that evaporation. Now, there can be other underlying diseases which medical professionals will identify, but I think it's really important to just understand that the demographic is maybe changing because of technology, and more people are suffering with this debilitating disease area.
So can this problem be helped by, well, for example, putting drops or ointments into your eyes? Can that help the situation any better?
Yes, absolutely. And I think if you have occasional dry eyes, the general rule is you go and see your GP, your pharmacist, your optician, and very often they'll recommend you to some proprietary eye drops. If it's a slightly more serious situation, they'll prescribe something that's a little bit more effective. But yes, using those ointments and drops can be very effective. But what we need to remember is that only treats the symptoms, doesn't treat any part of the cause. And so if it is a short-term problem, you've got some dry eyes, but if it starts coming back, then you may have an underlying problem. And this is where it's important to get that investigated.
So is there an actual treatment process, David? What is the process of treatments?
Well, initially you would go to your doctor or optician, and then you'd maybe referred on to an optometrist. One of the issues is that the new technology is not widely available. So your optician, your optometrist, ophthalmologist, these guys can take you down a route of prescribing ointments, oils, etc., and maybe try to identify some of the underlying causes of your problem and give you fantastic advice. But there comes to a stage where they really can't do very much else, and so you're potentially looking at an interventional treatment. For example, something like the Lipiflow treatment, which warms the eyes, warms the eyelid in a monodirectional way, so it doesn't warm your eyeball, it warms outwards, and also it massages the eyelid, and therefore this opens up these glands to allow some of the oil to come through and potentially unblocks them. I think the way I look at it is if you heat oil in a wok or something, it gets thinner. And if you want to unblock a drain or your plug, you use a plunger that creates positive and negative pressure. Now, obviously, this is a medical device and is a lot more accurate in the delivery of the heat and the delivery of the pressure. But then that then goes on to unblock those glands, and therefore the lipids start flowing, and hopefully that gets an easing of the problem.
I know a lot of people are going to be sad today. I want to ask this question as well, David, but does it hurt?
I wouldn't say it hurts. I wouldn't say it's a pleasurable experience, although a couple of people have said, that actually feels not bad. I think it's tolerable, and it's unusual rather than massively uncomfortable. But bear in mind, some people are going to have pain because they have the underlying disease. So they've got inflamed eyelids, these glands are blocked, there's redness there. Well, it's not going to be a comfortable thing when you start treating that margin, when you start treating that disease area. But for somebody like that hasn't got massive symptoms and they're trying to prevent rather than retrospectively trying to do something, then actually it's not that uncomfortable at all. And bear in mind, it is only for about 15 minutes in terms of the actual treatment. And so as a consequence, it's, whether it's worth doing 15 minutes of a little bit of pain for hopefully an extended period of gain.
So is this treatment a long-term solution? Is this something that can really make a difference and have a long-term impact?
Yes. The treatment will work for about, I think they say 79% in the trials. So, 2 out of 10 are not going to get that much benefit, but the other 8 should get significant benefit. And the majority of those patients will get benefit for about a year. Now, one of the things that is done is there is a support mechanism to give advice about how to prevent the dry eye coming back. So we do have some patients who benefit for significantly longer than a year. But I think with, these things, everybody's different. And the assessment stage in terms of checking whether the patient is actually suitable for treatment in the first instance and being realistic about what the outcomes are at the back end, then I think that's one of these things that you need to consider. However, if you're having this problem on a daily basis, you can't work because you can't look at a computer and you can't watch the TV, for example, then it's often worth the trying to get a positive outcome and then trying to maintain your eye health moving forward. And, it's an underused resource. The local optometrists are excellent and they will help you achieve your objective of a longer term solution. We need to understand there is no absolute cure for this type of dry eyes, MGD, gland disease, blepharitis. There's no cure. What we're trying to do is give long-term relief by treating the underlying cause rather than just masking the symptoms with drops, etc.
So, David, people sat at home thinking, you know what, I want to get in touch. I had this problem. I want help with this problem. How do people get in touch?
Well, it's pretty straightforward. The easiest way to do it is through the internet. We are Dry Eyes Clinic. Eyes, we have 2 of them, so it's Dry Eyes Clinic. And if you put that in, we're based just up the road. We have clinics in Widnes and our main clinic in Salford. So we're not a million miles away. And in addition to that, we need to understand that this isn't a widely available treatment. I think we're the most northerly point on the Lippy Flow map, if you like, within the UK. I think there's one down in London and one on the south coast. I don't know of any others. So it's something that is pretty local to you guys, and you can take advantage of this sort of cutting edge technology.